the commonest illness that human beings face, for example, arthritis, rheumatism, ankylosing spondylitis, eczema, asthma, allergies, urticaria, recurrent infections in children, asthmatic bronchitis, many kinds of psychological problems, depression, obsessive compulsive disorders. And name any kind of chronic disease, whether it's allergic, autoimmune. The long-term outcome with modern medicine is very, very limited. The treatment is short-term and also with many side effects. What's the reason for that? The reason is pretty simple and fundamental. The reason is that modern medicine approaches disease as something local, something that needs to be corrected at a local level. So you have specialists and more super specialists. 25 years ago, you used to have ear, nose, throat specialists, ENT. Now you have ear specialists, and then middle ear specialists, and then right middle ear specialists and left middle ear specialists. It's a bit of a joke, of course, but what it means is that the approach is very local, very, very organ specific. So you have liver specialists, liver transplant specialists, liver cancer specialists. So what happens with this kind of a organ specific local approach is that it does not factor in that actually the disease is not a problem of the organ systems, it's not a problem of the parts, it's a problem of the whole being. Modern medicine fully understands that. I mean, there is no modern medical doctor who does not understand that rheumatoid arthritis is not a disease of the joints. It's an autoimmune problem that involves the immune system. That asthma is not a disease of the lungs. It's a problem of an allergic response of the bronchi, which is based upon a hyperimmune system response of the whole being. Eczema is not a disease of the skin. It's a manifestation of allergy at a skin level. Everybody understands that. But still you have skin specialists and lung specialists and joint specialists. And what do? They first treat the part. So you have a painkiller. If you have pain, you have a painkiller. If you have inflammation, you have an anti-inflammatory. And because it's also immune system based, you have an immune suppressant or a corticosteroid. When your immune system is autoimmune, which means that your defense mechanism is fighting instead of the outside with yourself, it's gone crazy. It's not working normally. You're fighting with yourself somewhere. So what do? With steroid, you put the immune system to sleep. You put your security guard to sleep because he's fighting with you. The problem is that the moment he wakes up, he's going to fight with you again because nothing has changed in his mind. He's crazy anyway. And so what you have done is temporarily avoided the problem and loaded the body with the side effects of steroids, which are terrible. It weakens your bones, it causes hormonal problems, it causes hypertension, it causes edema, it causes everything. And it causes a sleeping security guard, allowing more infection to come in. So that's not the solution. Everybody knows that. But modern medicine does not have anything better to do. That's the problem. That's the reason why modern medicine, despite its unbelievable progress, remains limited in the treatment of diseases. And it will continue to do that, definitely. The question then is, what do we do with a disordered immune system? What do we do with this crazy guard who's fighting with you instead of with the robber? What do we do with him? Again, there is another viewpoint here, because the guard is not the one that we need to correct. The guard is a part of a system, a whole system. Is just an expression. The immune system is a part of a whole psycho-neuro-endocrine immune system axis, which is known as the PNEI axis.